a fender bender, your car isn't the only thing that needs to be fixed. Dr. Pritsker is here to help us uncover some of these hidden injuries right now. Dr. Michael, it's good to have you back.
Hey, thanks. It's great to be here again.
We've been talking about the great work that you're doing. Before we go any further, I want to mention that my wife, the Dr. Marianne, psychologist, bar none, just the best.
The best.
Right, is coming to see you for pain in her hand.
Yeah.
We haven't been able to figure out what's causing it, because there's nothing there that seems to be causing it, right?
Well, absolutely, yeah.
So and you had talked one time about a possible pinched nerve or pain or something that happened in the neck could materialize someplace else, which is what the problem is with her, right?
Yeah, there's something known as a double crush syndrome, where you can have an injury in the neck.
I have
and
a double crush on her myself.
I'm sure you do.
I do.
She's a wonderful woman. But absolutely, you can have a problem in the neck, and it can cause a problem in the hand, and cause a problem in the shoulder, so you get referred in radiating pain. That is very common.
Yeah, and this is the first time she's had relief in that hand in months since
she's doing very well.
Yeah, she certainly is. Okay, now let's get to the car accidents, okay? Because I would think whiplash is the number one, which is a neck injury, right? And so let's talk a little bit about what you do for that, and sometimes it doesn't show up right away.
Very commonly, what's the first thing that happens to you after you have a car accident? Well, you're more worried about the car than you are about yourself. You're thinking, well, how am I going to fix the car? How am I going to get driving again? And you really stop thinking about all those things that could have happened to yourself. If your car is damaged, there's a very good possibility you're going to have injuries in your spine, in your neck, in your low back. And very commonly, you might just have a little bit of a pain and you think to yourself, well, this will go away, or at the hospital, they told me there's really nothing wrong, to follow up with my doctor. And very commonly, a year later, several months later, you'll start to experience pain in your neck, pain in your back, and you think to yourself, I don't know how I got these injuries. And very commonly, it can be associated to a previous accident that you had several months before, sometimes even several years before. And that's why it's so important to really get those injuries checked out as soon as possible.
Right. So you can detect it right away. If you've had an accident in the last week or two, or even a couple of days.
Well, you can.
If you have obvious pain, obviously you're going to go right to the doctor. But if it clears up, and then all of a sudden you have something a little bit later on, then you should come and see you.
Well, that's why it's so important to go to a doctor who specializes in injuries from auto accidents, because very commonly, as I said, after you get into an accident, a lot of times a doctor, what they'll make sure you're not going to drop dead in 24 hours, and make sure you don't have a serious injury where you're going to have to end up in the hospital again. Yeah. They really don't look for, a lot of times, those little subtle injuries. Like from a whiplash, you could have damage to the muscles, damage to the ligaments, where over time it'll start to develop into a degenerative arthritis. And these days there are advanced tests that we use that can catch these types of injuries. We can catch them ahead of time, so you don't have to worry about the problem coming about later, because it's a lot easier to fix early than it is later on. And of course, we're notorious for waiting when you have an injury to fix it.
Right, because you say, well, it'll take care of itself, or you may not even notice it, and then the pain may show up someplace else.
Yeah.
Right, in a leg, or like in Marianne's case here. Of course, she didn't have a car accident. We don't know what caused it, but the problem is actually in the neck, right?
Yeah, so, and chances are it probably occurred from something that she had in the past. There could have been some type of repetitive stress injury that she had, and if her doctor at that time would have done the special testing, there are special diagnostic tests that we can do to determine if these types of injuries, first of all, if you have these, and if it's going to develop into a degenerative condition later on, such as degenerative arthritis, a disc herniation, sometimes even fibromyalgia. So all of these things can be associated to injuries that you've had previously. So it's so important to check for these injuries.
Is there any kind of a cream or an ointment that can give some temporary relief while you're working on it to get rid of it entirely? Yeah,
of course there are different types of temporary things, and just like I gave to Marianne, we gave her some BioFreeze, which is something that she can use to eliminate some of the pain while she's going through the treatment. So absolutely, there are different things that you can use.
Well, the BioFreeze works. I know that because a lot of them are just hype. I mean, you put the creams on and they feel hot or they feel cold, but they don't really get whatever it is, the analgesic or something, into the system.
A lot of them are hype, and what you also have to consider is some of them have salicylic acid, which is aspirin. And several months ago, they did have an incident where a girl actually overdosed on using these creams. So we try to use things where they're not going to have these types of problems. So as they go through treatment, we can, one, eliminate the pain, and two, actually get to the cause of the problem, so they don't have to worry about getting this degenerative arthritis or degenerative condition later on.
All right, excellent. You got some specials too. We were going to talk about that before we run out of time.
Yeah.
I want to get to those. So let's.
Well,
let's
first
talk
of all,
about that.
anyone can call to request our free DVD, which explains how to determine if you have hidden injuries from a car accident. And also, you mentioned the BioFreeze, so anyone that calls for this DVD will also get a tube of the BioFreeze to use for themselves to, help with some of the injuries that they have in the meantime, and then they can watch the DVD and find out if these injuries might be associated to their accident and find out how they can finally fix it.
Well, what does the DVD show? I mean, it shows you what different parts of the body and
well, it's going to show you, of course,
where you're having pain and what to look for.
It's going to tell you what to look for. So let's say if you've been in an accident, look for possible things where you can't move your neck a little bit. Look for different types of symptoms like headache. So it's going to show you these different types of things, and it's going to go into some of the treatment options that are available for these hidden injuries, so you don't have to worry about the problem later on.
Okay, there it is. You call Dr. Michael Pritsker, all right? You get a free breakthrough for back pain and injuries video. That's what we're talking about right now. And you're going to throw in some BioFreeze.
Absolutely,
with
we're going
this
to throw in
now,
some BioFreeze.
just like that. So call that number, 888-867-4951, and get yourself fixed up. Don't go through this pain, believe me. All right? Thanks, Doctor.
Thank you.
Michael. We'll see you again. Next time I'll talk about martial arts.
Yep.
Because he's an expert. He is a, black belt in Wahoo. All right, San Diego Living is coming right back, okay, with more Wahoo.